So you want to be a healthcare analyst. In today's episode, you're going to get a complete masterclass on how to do so from my friend Jason Bryll. Jason's got almost 2 decades of healthcare analytics experience, and he'll explain exactly what healthcare analytics is, why it's really needed in today's market, what role AI is going to play, and how you can stand out to managers in the hiring process. So if that all sounds good, let's go ahead and get into it. Jason, welcome to the Data Career Podcast. You have a very unique career because you studied finance in college, and yet you've really ended up in the healthcare analytics space. You were a senior financial analyst, a manager of financial analysis, a director of analytics, and now you started your own data consulting company, Parable Associates. That was in 2018. So you build dashboards, you do vendor performance monitoring, you do analytics for healthcare focused companies. How did a finance major kind of end up in this healthcare analytics space?
Well, my foray into healthcare was kind of happenstance. And so when I was in college, just through networking and friends, was invited to interview at a young consulting firm in the healthcare industry based out of Chicago, which at the time was known as Accretive Health. Now it's R1, which is quite a large firm at this point. But that got me into healthcare. And what I was doing primarily at that time, coming right out of college, was analyzing financial information. So all of the insurance claims that were being processed by hospital systems, the invoices for vendors that were supporting those insurance claims and collections processes, I was analyzing all that data. So I kind of stumbled into it just through networking and then found what was at the time a fairly small company. What really got me in there and made me the data person or guru was I took an Excel course in college. I really enjoyed it. I used it for typically financial modeling for not just healthcare, but for any industry. And it was the technology that brought me to healthcare, essentially. Like it was kind of fell into healthcare. Once I got into it, I absolutely loved it. It's a very mission-driven industry, and I've never left since I graduated in 2008 from Michigan State. So I've been with it ever since, using tools like Excel and many others.
I love that you were like, it was my networking and my friends, because a big pillar of my platform is like, okay, your skills isn't really what ends up getting you jobs. It's really your network. So I love that you mentioned it. Can you give us like a definition of healthcare analytics? Like what, to you, what is healthcare analytics?
So there's 3 categories. There's more than 3, but we'll just start with 3 categories of healthcare analytics. So there's obviously the clinical side. I think that's what people mostly think about when you say healthcare analytics. So certain things around diagnosis codes. If you're in the industry, they're ICD-10s. And so there's a lot of complexity into how patients are diagnosed and how they're treated. There's procedure codes, CPT codes. There's a lot of complexity in just the documentation of patient treatment. And then there's operational. So once you go into a practice, you might not be thinking about it as a patient, but when you're getting placed onto a schedule and aligned with a certain provider, when you are getting patient statements in the mail, every one of these points that you interact with all are operational in nature to make sure the practice is up and running and healthy. And then the last part is really the financial, and I'll couple revenue cycle into that a little bit. And so that's all the insurance claims processing. So healthcare is very unique in that the person or the entity that's responsible for payment is often not even in the room, right? It's not the patient, it's Blue Cross or it's Aetna or it's Medicare. And so there is an entire industry just around getting collections made for those services being rendered. All 3 of those, right? So clinical, operational, and then financial / rev cycle billing. All 3 of those could have their own data and analyst teams and groups, and they all have their own KPIs, their own nuances altogether. So it's an incredibly complex landscape that you can go into multiple directions within healthcare. But those are really the 3 categories.
It's so interesting because, I think most people, when you say healthcare analytics, they would think more of the clinical side, like the actual health side of things, like, doctors, tests, your health. But there is like a whole, like you said, like a whole business aspect to healthcare of like, how are we paying for things? How are people paying us for things? How are we scheduling all of this? And I think that's a side of healthcare analytics that people don't necessarily think of. So let me ask you this. Do you think that like, depending on the company and depending maybe on where they're at in the world or in the country, like could a healthcare analyst and maybe like, I was going to say revelations, but we're not getting any revelations. Maybe we are. Maybe our insights are that good. revenue operations analyst and a financial analyst, could they have three people have three different titles, but they essentially do the same thing, would you say?
They would, as far as the technical nature, it could be a very similar job, but the target audience changes, right? So as you're working on the chief medical officer and what their scope of work is, it would be completely different than operations. But either way, you're in a database, you're writing SQL code, you're extracting information, you're grouping it together, analyzing it, providing insights. The actual technical part of it may be similar, but understanding the audience could be completely different, right? And also with those different personas, so like if you're thinking about on the medical side, I'll give an example where there's a large urgent care technology company called Xperity, and they post these things on LinkedIn that say, here's what's happening with cold and flu season. And they'll show you like these heat maps, and it's important to their business because they're in urgent care. It kind of is a predictive model for healthcare across the country where you can actually see, flu ticking up at the end of the year. And it kind of goes from left to right across the country or whichever direction. Really interesting stuff. A lot of deep analytics in that, and obviously more on the medical side, looking at diagnosis and reason for visit. And so like that is a very predictive, forward-looking planning. Do you need more providers? Do you need more people on call to support the incoming influx of that population? And so you can get really in the weeds on that piece of it. And then the other side is, are you making sure you're getting paid for it? Do you have patients that have long wait times? And so now operationally, I need to know how my waiting room is doing. And so I'm very in the weeds on today, like real time data as compared to these large predictive models. It's a long-winded answer to say we're all working with data in different ways, but the target audience kind of dictates the type of work. So similar tools, different mindset on how you approach data depending on who your target audience is.
Very cool. Let's talk a little bit about more about Parable Associates. This is the company that you started. You guys help small healthcare companies basically do analytics, looking at dashboards and creating KPIs for them and stuff like that. And I'm interested because we mentioned earlier, some of the players in the healthcare space. Of course, you have the healthcare provider, then you have insurance. That's a big one. And I'm curious, like where you guys sit, because I think about some of the students that have gone through my bootcamp, the Data Analytics Accelerator. And one of the companies that has hired the most of our students is Humana. So they're obviously a large insurance company in the United States. And so the insurance company has their own set of data analysts. I'm thinking about maybe a hospital might have their own set of data analysts, but I know one of your clients is like a dentist, and I don't think many dentists, maybe like large national practice, hire data analysts. But is that the gap you guys fill, or where do you guys come into play?
Yeah, so you're right in that the insurance companies typically have a very large team of data professionals. Hospital systems have multiple teams depending on what they're trying to address. And then where we typically fit in is on the provider side. And so provider being the healthcare provider, so we do a lot of specialty care. So yes, dental is in that mix, ophthalmology, optometry, podiatry, orthopedics. Like there's all these different specialties, and dermatology, the list goes on, right? Of all these different specialties. And typically what happens is a doc that has, or a practice that has 1 to 2 docs, it may not have really significant data analyst needs. It's more of filling their schedule, making sure they get paid. And it's pretty, you can handle that with a very light lift. But we work with groups that start to get up into the 10, 20, 30 providers. They start to get so large, they need more oversight into their practice. And so that's really the entry point. I would say our target audience is anywhere from 20 to 200. We have some larger than 200 providers. So if you think about a provider count, the higher the count, the more complexity it can bring. And they're not just worried about the things that we talked about earlier. They're also looking at incoming referrals and where are they coming from, where are these patients coming from, because that's really like a version of marketing for them. These are small businesses, if you take a step back and look at it. They all have websites. These practices all have websites. They need Google Analytics. They need to understand who's interacting with their blogs and their traffic. It's not a given that their schedule is full. So they're very interested in Net Promoter Score, things that are outside of the medical field. And so if you're a general analyst or in business or have worked with small businesses, hopefully that sounds very relatable, right? Because that, if you take a step back and look at it, this is a small business that we're supporting. So that's where Parable comes in. You have a lot of medical professionals that are a group of providers, and they're not necessarily MBAs, but they're incredibly smart people, right? They've gone to so much schooling, gotten so much education, but they're not an IT professional, and they're not an MBA or a business professional, but they're running this practice, and it is their practice and usually a group practice. So what we do is we come in and we provide that data expertise. So we can do data pipeline connect all their different systems, everything from scheduling to patient input. So like all the clinical documentation, their practice data management, billing, collections, call center data, HRIS data. So all this information we can pipeline. And typically we're using tools like Microsoft Fabric is really, really getting some popularity right now. There's other Snowflake, Databricks, other things as well, but we're piping that data into a central lake, ultimately producing BI reports, most commonly in Power BI and Tableau. And so with that, when we have these dashboards and we implement them, now these really, really smart people have the data visualized in a way where they can immediately make decisions or be more confident in their decision process and make sure their priorities are correct when it comes to providing high quality patient care, look to expand into different services, how do they support their population of patients, and make sure that they keep coming back. Right. In dental, you got to make sure your patients are coming back every single year for their annual visits and checkups. And then you have to support them as they have something documented. They might need some care or things like that. So how do you support them in that process? You got to really have your data together and telling that story for you to know how to interact with the large, group like that.
Gotcha. That makes sense. So your job is basically to get all the data into a usable place and a usable format, and then show them some key insights from it. That makes a lot of sense. Two of the words I saw on your guys' website, I've heard you talk about before, is revenue cycle and accounts receivable. For us laymen that don't know much about like healthcare, can you just explain the definitions of like what is revenue cycle and what is accounts receivable?
Yeah, absolutely. I think a lot of people are shocked to hear this at first, but when you go see your dentist or when you go see a medical professional for any service, maybe it's again in podiatry or some other specialty, when you have that visit and it's documented, that provider's not going to get any payment whatsoever for that visit unless they collect a copay when you're in the office. But other than that collection, they're not receiving the majority of their payment for about 30 days, sometimes longer if there's an issue with that payment or that process. The reason for that, and where do you catch these gotchas, that is the revenue cycle. And so the revenue cycle really starts in patient access. And so patient access is if you are referred to a specialist and your primary care physician says, hey, you need to go see this dermatologist for that spot on your skin. A lot of times that is required by the insurance company. They say, we're not going to pay this dermatology visit unless we authorize it. So there's these authorization codes that they'll give you. Then you have to be referred to somebody that's in network. And when you're scheduled, those codes come over. So that way, when it goes out to Blue Cross, they say, oh yeah, we authorize that. Based on that diagnosis, we authorize you to do that. So we will pay for it. And so there's this behind the scenes work that's being done communicating between the providers of care and the insurance companies for covering that care. And most people don't know how complex that it really gets. And what that does is it delays payment. In healthcare, the hot topic right now, if people are listening and like, okay, that sounds, pretty burdensome. There's also this concept of denial of payment. And so if you don't have that authorization code or you do something that you weren't authorized to do, go above and beyond in providing care, you can get denied for payment. And that's a really, really hot topic in healthcare right now. And I encourage anybody who is interested in finding a job in analytics to dive deeply into research on denials because they're going up pretty dramatically right now in the industry. It's a great opportunity to learn how operationally your insights and analysis can create predictive models or impact healthcare providers and accelerate that reimbursement. Because if you're denied, then you start the clock over. It's another 30 days. Now you provided a service, you don't get paid for 60 days. That's a lot of carrying costs for a practice. So really rev cycle is everything from patient access through billing a claim out the door to the insurance company and getting paid and posting that payment against that receivable. And there's so many steps along the way. It's incredibly complex, which is why it really requires or necessitates its own analyst team or analyst skill set. There's so many different workflows along the path that if you know how to work with data, write great code, or even just create great visualizations, you can find those gaps or where claims might be falling through the cracks or delayed for payment. You can find them so much more quickly. And that really helps support, for us, it helps support our clients, but those that you serve with the data.
Very interesting. So yeah, I think part of the problem I've had with like wrapping my hand around what this is like, if you look at like my business, my boot camp, right? I have like one price point. The people who are benefiting from the product are the people paying for it. And in order to enjoy the product, you pretty much pay up front. Now that does get more complicated when I do like payment plans for people because people's credit cards fail and they expire and stuff like that. So that does or increase the complexness of it all. And so it's like, okay, well, that's only for one product for only, not that many people versus like a ton of people, a ton of different products. Every time they come in, they're getting probably multiple and maybe different things. And some of those are going to be approved and they have different insurances and you're bringing multiple third parties into it. I can see how that gets really complicated really quickly. You'd need someone to take care of it. So is that like what makes healthcare data really difficult? Is like basically there's like so many different products. Everyone literally has it. Like I have 2 kids and my 2 kids go to the doctor like every other month basically. And they always have stuff going on, it feels like. And then like this doctor's system is not the same as this doctor's system. And then there's my insurance and my wife's actually on different insurance. And is that what kind of makes this whole thing difficult?
That is a big portion of it. So yes, I'll tell you a little bit like what I hear when you're talking through that, just as a data professional in the healthcare industry. When you say, I have this insurance and then my family's on this insurance, I'm thinking about a guarantor-patient relationship. There's a responsible financial party, which adds complexity to it, where, the parent is the guarantor. They're the one that really ultimately the statement goes to. And so that's one layer of complexity. You might go to a different provider than your children who maybe go to a pediatrics office. So they don't necessarily know like the family history. They can't just pull it from your chart because it's over here in a different organization. And then even that other organization may be on a different medical record software system. So even though it sounds like, well, can't you just pipe my data over here? Aren't you guys friends? You're in the same zip code, right? It's not that easy either because that data ingestion may not exist even across different platforms. So there's a ton of complexity because again, you have so many different systems. If you just were to look up how many different medical record software companies there are, on the hospital side, we see a lot of Epic is a big name that you hear a lot of. Cerner is a big name, Meditech, but then get into specialty care and there's a whole group. I mentioned Experity earlier in urgent care. There's WebPT and physical therapy. There's ModMed and multi-specialty. So there's all these different platforms and every one of them is their own business, their own entity, and they're typically servicing a specialty, a very specific group of individuals or provider types. And there's a lot of value in that because that niching down has really helped them grow as a business and solve the problems and pain points of that specialty. And so that's why they have those softwares. But it doesn't mean that everything talks together. And so interoperability would be the term that I would use, but interoperability does tend to be a challenging point. So if you go to a specialist and then go to a hospital, they may not have all your data, right? And then that's more on the clinical side and operational side. And so those data pipelines that there are companies that support or they do help with, there's things called HL7s that have been around for a long time to help stream or pipe that data from one organization to the next. API calls, all sorts of stuff, different ways to get things over. On the financial side, again, it's the complexity of the insurance companies and the relationships and the types of services being rendered. If you think about it in terms of, I always say give empathy to each party when understanding like the motives behind why is healthcare billing so complex. If you think about the provider, they want to provide excellent patient care and get somebody healthy. That is their motivation. And then ultimately they want to get reimbursed accurately and timely for that service. And then you have the patient who has been paying this insurance company for some sort of coverage, and maybe they totally understand it, maybe they don't understand it at all, but they know they have this insurance coverage just over here. Then you have insurance. Insurance is really making sure that they're operating on behalf of the patient. And so they don't want to pay for services that they shouldn't have to. And so they feel like they're protecting the patient. But now we've created this triangle where there's a provider who wants to do anything they can to help the patient. Maybe that's above and beyond the line of, what was already authorized. And then the insurance company says, no, you can't do excess work like that. And so they'll deny payment. So now we have this triangle of complexity because everybody is doing the right thing. I don't want to, sometimes you get into healthcare and you hear like, oh, this is who's the bad guy in the mix. There is no bad guy. It's really complex and you have to kind of find that equilibrium and balance. And 80% of the time, everything flows perfect on the reimbursement side. And 20% of the time, there's a denial or an issue or something that creates longevity in the reimbursement cycle and all that confusion, which is a really high percentage when you think about the volume. But yeah, you have multi-party over here. And yes, you do have interoperability. You're one patient, but every time you go somewhere new, you're creating a brand new record within that a host system, whatever that practice is. So your data is all over the place. and your family's data too.
Very interesting. I feel like I just learned a lot, and I heard a lot of words that I maybe know the definition of, but maybe haven't ever used before or something like that. And it is really complex. And this got me thinking. This takes a lot to understand. Like, I have my wife's a nurse, so she knows some of this stuff. But like, I've never worked in healthcare. I've never worked with a healthcare company. I don't even think. So I was thinking, like, let's say that they're building a new hospital in Utah or something, right? And I want to take my consulting company, Snow Data Science, and I want to do data analytics for them. Well, let's say you're also bidding for that same contract. You're going to blow me out of the water because you understand, let's say even my company, we're better at Tableau, we're better at SQL, we're better at the data warehousing stuff than you guys, right? You guys are still going to blow us out of the water because we don't know anything about the domain and all those fancy things. And, I knew Epic, but the other ones, I have no idea. I've never even heard of them before. So I was just curious, like, what role have you seen in your career domain play and like domain experience? Because the other reason I wanted to bring this up was you were listening to the episode I did with Melody Santos, who went through my program and then went through your course. She was a former physical therapist, and then she transitioned into kind of a revenue cycle analyst now. And she was able to grab that role because of her domain. So I was just curious, like, what role do you think domain plays in data careers?
I think it's right now, it's already an insanely important detail that you have to understand the operations. It is going to grow in significance in a very short period of time here. And I say that because we're on our side, we're already using a lot of AI technologies to help streamline SQL code writing, take natural language questions and turn them into code. It's not perfect yet. We still have to audit it. We still have to be technically sound. Same thing with dashboard development and so on. These tools are helping accelerate the productivity or enhance the productivity of us as analysts. The true differentiator is our depth of knowledge within the industry we serve. So to your point, yes, I would blow you out of the water in that scenario because what they're looking for in a partner is not just somebody who's really sound in technical capabilities with Tableau, but can you get the answers to the questions that I have? And can you predict the next question that I may ask? And can you verbalize it to me in a way that I understand and can read and react quickly? And the only way you can do that is being really deep on understanding the operations and the workflows. I'll tell you, one of the things that we've done as a business is every one of our project managers has a deep knowledge of healthcare and a knowledge or certification within one of the BI applications or data engineering applications. But I will tell you, like, it is definitely 90% of their conversations are more on the operational side and seeking to understand what is the pain point? Why is it a pain point? Have you tried this? Have you tried that? Oh, by the way, our other client with a similar issue did this. Now I can relate a different issue to yours because you're a healthcare practice, they're a healthcare practice. It's a massive, massive benefit because you talk the same language. And I'll tell you one of the most critical reasons why is when somebody's looking to hire you as an analyst, or they're looking to hire you as a consultant organization, they are also thinking about themselves and how much time they have to put into the project. So if you come off sounding like I can do all of this technical development and I can take that burden off your shoulders, that's great. But how much time do I have to spend with you telling you exactly how a dashboard should look? Here's how to calculate a certain measure. Like I need a dashboard with DSO, AR over 90, agents last touch. And you're like, what's a touch? Like, what do you define as a touch? Or what is DSO? I don't even know what that is. Let me Google how to calculate it. That is time that they're burning that they don't have. They want to hire you. They want to bring you into the organization with some understanding that you empathize with their role, their position, and you can accelerate through those conversations. They don't want to spend any extra time. They want a done for you service program team member. And you're never going to find a perfect, resource, but the more you can act like that, the better. So that's that. We lean hard into that in our discussions and our marketing, but also operationally and training. As you mentioned, the academy course that we built, a lot of that was actually built for internal consumption. So when we onboard people, we can catch them up to speed with all the things that we're doing within healthcare and rev cycle. So they're going into clients highly educated on what those topics are.
So if I heard you right, like domain experience has always been valuable, but in an age of AI, you think it's only going to be more valuable because basically not everyone, but a lot of people will have equal tech skills. So the thing that really sets you apart is your ability to actually understand your domain and the business problem and the business jargon, that's what's going to basically set you apart. Is that what you were kind of saying?
Yeah, absolutely. Yeah. And I mean, not just the business jargon, but one step further. And if you can, if you're the problem solver type of person, one step further into the solutioning, right? So you can use data to identify certain things, you can calculate certain measures, but then take that power that you have of combing through data and take it one step further, make a recommendation with it that's specific to that industry or workflow. And it could be supply chain, it could be anything, right? But like, or in your other podcast I was listening to, talked about, you could do it in retail, or you could do it in, the restaurant business. There's all sorts of things. Like if I knew anything, I don't know anything about the restaurant business, but I imagine spoilage is some, concern that they have with things sitting on the shelf for too long. So if you had great analytics about it, you could make a predictive model on when you should create an order for your lettuce. I don't know. You know what I mean? Like you could beat me in that conversation, I'm sure. When it comes to healthcare, now I'm thinking ahead, and now I know those workflows so well. It's incredibly powerful. People, again, they want something done for them. They're looking for you to take it as far as you can and then give them the handoff so they can make the decision and feel confident and empowered that you've done your QA, you've done the quality audit, you've done the next layer of research, and you're giving them the most qualified information. And there's a trust there. That trust only comes through deep knowledge within a certain specialty or industry niche.
So it makes sense from a consultant standpoint that these hospitals, they want to hire people that know hospital stuff. But is that something, I don't know how big Parable Associates is right now in terms of employees, but you've obviously hired quite a few people. Is that something that you look for in your hiring process?
Yeah, absolutely. Yeah. Yeah. So we have roughly 30 employees right now, and we are always prioritizing healthcare experience. Now, we're fortunate enough to do that because we're small enough where we're not doing a lot of college hires. If I was doing college hires, I would be looking for technical experience, and I would have my training program to fill those gaps. But I'd also set an expectation that that's, what I'm looking for is to grow somebody, give them the career development and so on. So those opportunities are there. But I'll tell you, when I graduated from college in 2008, I don't know when YouTube really got off and running with a lot of details and other platforms, podcasts like yours and alike. But just getting the first layer of understanding, getting interested in some sort of industry. There's so much content, whether it's YouTube or whether it's just, or even joining a course like yours and having a community or a cohort, just grouping together, building that base knowledge, at least demonstrate some level of understanding and that you're willing to learn within a certain industry. Demonstrate some of that when you're in the interview process. I can't recommend it enough. But yes, we look for healthcare experience, and we look for people who are genuinely interested in the industry, whether it's clinical, operational, or financial. If you have one of those, it's a good chance you'll at least get an interview with us.
When you say demonstrate, what exactly are you meaning?
Specifically, when we're combing through resumes, if somebody has a portfolio, we'll jump into the portfolio. If they don't have a portfolio, if they have history in the healthcare industry, that's a plus. And if they have no experience whatsoever, but they're part of certain groups or communities that they're documenting again on their resume or what have you, if they're following certain people, if I ask you, who do you follow online? And those are questions I ask too, because that tells me here's what you're interested in. What we're looking for is who's genuinely interested in the work that we're doing. And then we can get deeper as to why are you interested in healthcare? What specific area of expertise you're looking for? Show me something that tells me that you're interested in technology and the industry, whether it's, again, part of a club, portfolio, or just prior work history. Show me something.
Awesome. I am a very strong proponent of portfolios. So that's what I was hoping you were going to say. I didn't know, but it was, I'm glad that's what you said, because I agree. I think portfolios are much more powerful than anything you can have on your resume, because it's literally tangible evidence that you can do cool stuff that you can analyze.
Let me hit on something about portfolios really briefly. If you have a portfolio, have somebody else QA it, look at it, have it be a really good portfolio. Don't put junk out there in the atmosphere. Have something that's polished and clean. No spelling errors. You'd be surprised at how often we get that. Our portfolio is a major plus until it's a negative, right? So don't give me something to pick apart and say, why did you do that? Oh, you missed that. Oh, that's sloppy. Have it be super polished. If you have one, to some extent, it's as important as your resume, right? I'm going to look at it. I'm going to get in the weeds on it. And it's a major plus if you have one, but make sure it's a high quality portfolio. For me, it doesn't have to be healthcare. If you have healthcare experience and you have a portfolio using dummy data or data from the it's publicly available, different industries, just show me that you're demonstrating technical expertise. The best portfolios that I've seen also include some sort of a page with documentation that says, here's kind of some of my underlying queries. If I'm using Power BI, here's the DAX code that I used. Just give me something that tells me a little bit more of your approach. And that's a major win for us as well. If we can walk through the thought process, and we're not looking for perfection, because we know that we'll train you on, CTEs and SQL, and we'll train you on certain things and how we approach data and analytics, but at least give us the thought process. Show me it's intentional.
Love that. Yeah, we try to do long project write-ups or recorded little 5-minute Loom videos when we do our projects. And that's one of the reasons why I hate on GitHub a lot of the time, is because people will consider GitHub a portfolio, which if done correctly, it totally can be. But a lot of times people just throw up SQL queries in GitHub and they're like portfolio, or they send you a link to a Tableau public page and they're like portfolio. And it's like, okay, that's great. That's part of it. But like, we have no idea what you were thinking. We have like no idea on your approach to this data set. We just know kind of, not even with the SQL code, the end results. We just kind of know the middle results of the SQL. So I love that you mentioned like, try to give more of a realistic full 360 view of what your approach was to it, because you're doing it to show this is how I would try. If hired on the job, this is kind of what you would expect from me, basically. This is the best representation I can give to you of what it would be like to hire Avery as an analyst. Did you agree with that?
Yeah. And again, as far as putting the polish on it, making sure it's a sound, portfolio and a sound example that you'll do. If you put a number of hours into it, the value on the other side is fantastic too, because that portfolio is an investment in you. It's an asset to you as an individual, as a professional. And you can easily apply to multiple positions and use that same portfolio, right? So it's worth especially in the competitive landscape we have today with hiring. I mean, when we put a posting out there, we get hundreds and hundreds of applications. It's incredible how much talent is out there that's actively seeking opportunities. So if you really want to stand out, first of all, build it. That automatically puts you in the top 20 percentile easily, because not enough people are doing it, right? 2 out of every 10, 20% are even doing something at all. And then give me high quality. Now you're in the top 10%. So it's a differentiator, and it's worth the investment when you're being, put into such a competitive landscape. Highly recommend it.
Makes a lot of sense. I wanted to ask you something you mentioned earlier, in terms of tooling, data tools that you guys use. You mentioned Fabric, you mentioned Snowflake. We've talked about Power BI, SQL, Tableau. Do you guys have like a data stack that you kind of stick to? Or do you kind of have to be flexible for what your customers and clients want?
We typically recommend Microsoft. And so historically it's Azure Data Factory, the tool set. They've rebranded a lot of it as Fabric, a one data stop analytics platform. We're a big fan of Fabric. We've been able to do a lot of really impactful things with it. And we do everything from the data engineering side, ingesting the data, whether it be connecting and doing like Snowflake mirroring is available now, stuff like that. But connecting to different data sets, piping that data over, storing it, analyzing it, writing SQL code against it. And then the BI application itself, Power BI. Power BI has really taken a big leap in the past, I'd say even like 2 years, maybe 3 years, like a massive leap in popularity. I think it's because so many people have, Microsoft Office. But we've done a lot of work with Tableau as well. So we're also Tableau experts, and we've implemented Tableau at many other customers and clients. Love Tableau, love Power BI. I highly recommend those two simply because of the opportunities that you can find. People are using those applications. That doesn't mean that I don't think there's value in other BI applications and tools. There's a bunch of them out there. But I would say the majority of what we see in the industry is Microsoft Fabric, Power BI, and Tableau. Those are the two that we see the most of. The other things that we see in the industry right now, we do work with Snowflake and we do work with Databricks. Those are two cloud platforms that I think are also worthy of note. But for the most part, we're recommending Microsoft Fabric with our customers who don't already have something. And if they do, usually Microsoft, I would say probably 80% of our clients, if I think about it, are using a Microsoft BI platform.
It makes sense. A lot of people already have Power BI included in like their giant enterprise Microsoft deal. When I was at ExxonMobil, we had Power BI available, I think, to a majority of customers just from the Microsoft deal that we had. But we still used a fair amount of Tableau as well, although those licenses were a little bit harder to come by as an analyst. So yeah, I think either of those are great things to build upon and learn as well. Jason, I'm really curious, like what advice, like if someone maybe is watching this I know we had a nurse comment on my YouTube video last week, or maybe they're an occupational therapist, these people who are maybe in fringe healthcare positions and they're like, I'm interested, I'm a little tired of bedside clientele work. Like I'm interested in becoming a data analyst and having like a more 9-to-5 desk job. Like what advice would you give them?
When we hire people to be analysts, I'm going to go in the reverse direction and then bring it full circle. When we hire people to be analysts, I always try to do some sort of job shadowing or workflow review. So if somebody's, let's say, doing insurance follow-up and here's the claim, here's the patient, I know it's 60 days old from the date of service. I'm going to go to the Blue Cross Blue Shield website and I'm going to type in this number and here's the result. And so we walk through that whole workflow. Then as an analyst, you can start putting the workflow together in terms of data. Oh, did they put a note in the system? What codes were here? How do we trend and chart that information? But seeing the workflow helps you understand better as a data analyst. Well, now you're talking about people who know clinical workflows, perhaps, or maybe they were in AR follow-up or accounts receivable follow-up, following up on these claims, and now they want to get into analytics. So you understand the workflow, but maybe it's worth job shadowing or talking to data professionals that are either in your own business or practice or through communities like yours and seeking out, how do I move data from A to B? How do I cleanse the data? What does the medallion structure look like and why? But like you need to kind of see the tools. So I highly recommend reaching out to those in your network that you can, seeing if you can just see what it is they're doing. Go to YouTube, get some documentation there. The only gotcha I'd say with YouTube is it's typically not curated content. It's not linearly taking you through. And so I highly recommend a course. Once you get to that point where like, this is something I'm interested in, I think I could do that. I would like to have that approach to problem solving and using data. Find a course that speaks to you, become part of it, but you understand the healthcare part. Now you need to understand the technical. So you need to see it. You need to start playing with these tools, get the free licenses where it's available for different BI products and so on. You got to start playing with it, do some job shadowing, get your feet wet.
I love the job shadowing. That's like something that I feel like is like almost disappeared from society. And I feel like we should bring it back. Yeah. I love what you said also about like get some hands-on practice. And I think that's something that we do well in our accelerator bootcamp is like we build real world projects on real world data and we kind of walk you through step by step of how to do the analysis. I think that's something that you do very well in the Parable Academy, which I've had a chance to check out, and we'll have a link in the show notes down below, where like I feel like when I went through that, I feel like I was doing a job shadow where I was like literally following someone through step by step, a real use case of like, this is what it's like to be like a cycle revenue analyst or something like that. Like actually like, this is what it looks like to be a healthcare analyst with kind of like the billing and accounts receivable and stuff like that. So I think maybe the job shadows have disappeared from society, but I think these are pretty cool alternatives where you can kind of do it at your own pace and at your own schedule really conveniently. So we'll have links to the show notes to all of that down below. And Jason, I just want to say thank you. I feel like I learned a lot about being a healthcare analyst today, and I'm sure a lot of our listeners did as well.
Yeah, I appreciate the platform to talk about it. We're always looking for more talent. So please go through these courses, get acclimated to healthcare, and then, keep an eye out for our postings because we're trying to grow and expand. And I love this healthcare industry. I can't recommend it enough to anybody who's listening. Please look at healthcare as a landing spot for your talents. Thanks for the time. Thanks for the opportunity.
Yep. Thanks, Jason.